You know, I always say to individuals, I'm the coolest health director around. um, because I try really hard to remain human, and not put your, you know, not as quickly as you made it up the ladder, as quickly as you can fall when you forget really what inspired you to go into that field. I get this job, and now I'm here. I am considered an outreach worker. I had to learn this community, and so I was in charge of promoting, you know, maternal and child health services, folic acid consumption, and immunization rates for children, and educating um, parents about the importance of vaccination. And so I had to quickly figure out where our Black and Brown communities were in the Valley, and try to identify, you know, other in communities that needed these services. And so it was great that I was able to connect and build relationships. And so I learned really early on in my career that it's so important with community networking and investing in networking and building relationships, because when you have limited resources and you have these partnerships, you really can succeed and create change. I worked for the AHET network, and really evolved and created the first medical interpreter program in Connecticut, where we really promoted language access and cultural linguistic barriers that exist among healthcare, and the inequities among people that have limited English proficiency. And so we created this initiative and effort across the state, and really worked with a statewide network of individuals. It was called the Connecticut Multicultural Health Network. And we literally worked collectively for many years on trying to address health disparities on many levels. You know, we are in such a trying time of starting, you know, this new decade with a pandemic. And then we started this new, you know, this new pandemic. You know, I was a new health director for the city of New Haven, not new in my position because I was a health director for another large city, but nevertheless new for the city of New Haven, and was so happy to be back home, where really that this was my inspiration to really go into this field. But really seeing how we're struggling with this pandemic, and then having you know, this racial distress in our community, those two things coupled together is just so heavy for any human being to really carry. And so when we talk about the racial impact and racism in our country, and how it impacts health, and then the fact that people are protesting, and you know, I had to give out a public notice of, yes, it's important, racism should not be tolerated, and we should have peaceful protests, but please wear your mask properly, because I don't want you to get sick, right? And so it's so difficult, because you want to be respectful of, yes, people should be angry and people should want systemic change, but we don't want to spike. Regardless of where my career path has led me, I know that I represents a lot of voices that otherwise cannot be heard. And I consciously try my best to know that when I'm at the table, that I have the influence to create positive changes, to change policies that can create barriers. And so when we have these opportunities, and it's important for us to remain humble in our success. When you reflect back on people that were influential in your life, it's so important, as different Latinos and young Latino individuals, and young students of color. You know, I always encourage them. I always take the time to provide any little mentor that people ask me for, because that's what got me through a lot of things. And I love how vibrant and young people are when they just message me on in LinkedIn and they don't even know who I am. I think that I wish I was that brave when I was young. And I think, you know, our newer generation have been doing a lot of effort about advocating for themselves. I see that I'm an adjunct professor, so I sort of see young people, you know, they have a different voice, um, compared to, you know, decades ago, just a decade ago.